The Health Impact Fund is one of the more concrete projects that I pursue at Yale in the context of my global justice program that I run there. And the Health Impact Fund is an idea about how we can improve the provisioning of people with pharmaceuticals. As it is now, pharmaceuticals, when they come on the market, are protected by patents to allow innovators to recoup their investments in research and development by marking up the price of a product. And as you probably know, pharmaceuticals, once you know how to make them, are relatively cheap to manufacture. And cranking out another 1 million pills isn't very expensive, but they still retail at very high prices simply because pharmaceutical companies have these temporary monopolies on the product. Now, the Health Impact Fund leaves that problem problem and the way of rewarding pharmaceutical innovation in place, but it adds a second track on which pharmaceutical companies can be rewarded if they so choose. And the second track says to the pharmaceutical companies, you can register your new pharmaceutical with us, and if you do it, we will reward you on the measured health impact that your medicine achieves in the world, on condition that you give up the other reward, namely that you don't mark up your product. So sell it at cost, which would be a very, very low price. Sell it at cost, and if you do so, we'll make it up to you through these health impact rewards. That, of course, requires that we have funding. And so the Health Impact Fund is something that would be funded by governments and maybe also by private donations from foundations, individuals, corporations, and so on, and would have at its disposal something like $6 billion a year that would be divided among registered medicines in proportion to how much health impact each of these medicines achieves. That's the basic model. What it would do for us is it would, first of all, incentivize the development of medicines for the poor, because suddenly you can make big money by having a new medicine for a disease that only poor people have. And secondly, it would make all medicines that are registered with the Health Impact Fund immediately accessible also to poor people, because poor people would only pay for the actual cost of producing the medicine. They would not pay anything for the research and development that went into the development of the medicine.